Thank you to the Dystonia Network of Australia for allowing myself to share our work with you today, as well as their ongoing commitment to raising awareness and providing advocacy for individuals living with dystonia. My name is Dr. Joel Maamary and I'm a Movement Disorders Fellow at the St Vincent's Hospital in Sydney. I'm also currently completing a PhD at the University of New South Wales, and I'd like to share the details of our work with you today. As part of our program at the St Vincent's Hospital, we treat many individuals living with dystonia in all of its forms, and are very fortunate to have a department that provides holistic, patient-centred care, led by the esteemed Associate Professor Stephen Tish and Dr. Sam Belitho. We are also fortunate enough to be a leading centre at the administration of functional neurosurgical approaches for many different movement disorders, and our current project relates to a novel treatment option for individuals with focal hand dystonia. Now, I'm sure you'll undoubtedly hear about further information relating to focal hand dystonia during the Dystonia Network of Australia's Dystonia Awareness Month, so I won't spend too much time going into the details of this disorder, but I would like to mention those who may benefit from this treatment. Now, dystonia can affect any part of the body, and when we discuss focal dystonia, we're simply referring to those forms of dystonia that are localised to a specific body part. And focal hand dystonia refers to that condition where the involuntary or sustained or repetitive movements are isolated to the upper limb, and they're often task specific, and we see this in conditions known as writer's cramp and musician's dystonia. Now, currently there are many treatment options for individuals with focal hand dystonia, and these include physical therapy and retraining strategies, as well as various oral medications and local therapy with botulinum toxin injections. Additionally, functional neurosurgical approaches can be used in dystonia. Now, this involves the surgical interruption of the brain pathways that are involved in the generation of the involuntary movement. But the main issues with these procedures historically is that they're invasive and they do have associated risks. However, using a combination of newly developed MRI and ultrasound-based technology, we're able to provide a minimally invasive alternative to these other neurosurgical approaches. This technology is aptly known as MRI-guided focused ultrasound and is currently both FDA and TGA approved for the use of treatment in tremor disorders. Recently, however, a pilot study was conducted in Japan examining the effect of this technology in individuals with focal hand dystonia with very promising results. Now, I've got a short video here that I'd like to help illustrate the procedure. Firstly, I want to say I don't take credit for this video, and I wish to acknowledge Insightec, who have produced this video along with its appropriate copyrights. What we do in this procedure is we use advanced magnetic resonance imaging techniques to identify those specific pathways in the brain that we believe to be involved in the generation of dystonia. And then, without requiring any incision or general anaesthetic, we deliver highly focused beams of ultrasounds to this very specific target within the brain. This results in the generation of thermal energy where the ultrasound beams converge right at our target and interrupts the aberrant signals that are generated by these pathways, leaving a very small lesion behind following treatment. The easiest way to explain this, I find, is to think of the analogy of using a magnifying glass to focus beams of sunlight, which I'm sure as children we all no doubt experienced. Now, if you focus the beams of sunlight really carefully and accurately, you may be able to burn a small hole in a leaf or a piece of paper, but you can actually pass your hand between the magnifying glass and whatever it is you're targeting without any harm occurring whatsoever. When we perform this treatment, we assess our patients very regularly and we monitor for the development of any side effects. And unlike many of the other methods of treatment in focal hand dystonia, we do hope that this potential treatment option provides unique, long-lasting treatment benefit, as well as minimally associated side effects and motor costs to the hand. Now, our aim is to perform this treatment in an Australian population and replicate the exciting results seen in the most recent pilot study. I wish to thank the Dystonia Network of Australia for their support of our project and the provision of PhD funding for myself to assist in exploring this exciting new technology. At the end of this video, I'll attach my contact details as well as the relevant references for your information. Please feel free to contact me if you require any further information or have any questions. Thank you again, and thank you to the Dystonia Network of Australia.